My name is Cornel Sieber. I'm the director of the Institute for Biomedicine of Aging at the Friedrich-Alexander University in Erlangen-Nürnberg. My clinical position is that I'm chief of the Department of Internal Medicine and Geriatrics at the Krankenhaus Barmherzige Brüder in Regensburg. So from my background, I'm treating elderly people. Most of them are so-called oldest old people at an age of more than 80 years old. We all speak about the demographic shift in Western societies, but also in emerging countries like India, like China, Mexico, and Brazil, the demographic shift is a topic which more and more importance. Many often people think that is more a challenge that we have so many elderly people, but we also have to know that it should be something we should celebrate. If I ask my people what they would like as a treatment for me, they always say that most of them are multimorbid. They would like to keep their functionality and by that their independence, which is quality of life. How you can measure functionality in the regard of malnutrition? We first need a screening instrument. There are many available. For example, the mini nutrition assessment test, especially developed for elderly people. If you see that there is a risk for malnutrition or even malnutrition, you have to make a formal assessment, then start the treatment. This treatment is usually in an interdisciplinary team, being composed of doctors, nurses, dietitians, nutritionists, and because of the strong link of functionality, not just with nutrition, but also with physical activity as a whole, also with physiotherapists. Having said so, we have a syndrome which is most often linked to so-called sarcopenia, which is the loss of muscle mass in the elderly, and it comes with the symptom of frailty, so the frail situation of elderly people when they are stressed for different reasons. The good thing in all that is that with regard to nutrition, we have good treatments at hand. They usually are composed of a protein-rich diet, as long as the caloric intake anyway is assured. On top of that, I think on the nutrient level, vitamin D is important, and it's also the distribution over the day when people have to take this nutrition and especially proteins in. So altogether, with regard to the functional decline many elderly people see, it's a huge burden for the whole health system on one hand, but on the other hand, we have the chance with an adequate nutrition to really tackle the problem. Nevertheless, awareness is not yet as it should be, and there are many concepts to promote the awareness of it. One of it is the concept Fight for Malnutrition, which is a European concept sponsored or co-organized by ESPEN, but also other topics within our society, which is really good, looking that we can overcome the problem of malnutrition in elderly people in our society.